Hi, I'm Carol with Black Girl Reflex. Thank you for joining me. Today's video will discuss the topic of neuropathy. Many people in our community, the Black and Brown communities, suffer from this condition. It is a condition, it is not a disease. It is a condition that develops as a result of other diseases, such as diabetes, alcoholism, vitamin deficiency. Even people who are experiencing chemotherapy will often develop neuropathy. So the first thing that you should consider if you're having tingling, paining, burning sensation, numbness, temperature changes in your feet, discuss these events with your medical provider. Reflexology, it can enhance medical treatment, but it is not a substitute for talking with your doctor and fully describing what you're experiencing. Reflexology can help you manage the symptoms, but you should have an actual diagnosis and treatment plan from a medical provider. So that's first things first. Now, as I said, neuropathy is a condition. It results from diseases, and it is something that you can work to manage. So today I'm going to share a routine. I'm going to point out the key reflex points on the foot that you can do on yourself, or you can do on someone that you're taking care of that may have neuropathy. So I'm going to start with my foot model. If you've seen my other videos, let you know that all of the reflex points in the body are reflected on the hands and feet. All of the organs, all of the systems have a reflex point on your hands and feet. So a quick review. The big toe on either foot corresponds to the top of the head, the central nervous system. The second and third toe correspond to the eyes and the eye sockets. The fourth and fifth toe correspond to the ears. Running between the toes is the lymphatic system, and that can help you to push toxins and debris out of the foot and up through the body to be released in your body excretions and urine and feces, sweat. So, starting with the foot, the key organs that we're going to look at, the top of the big toe, the top of the head, the central nervous system. We're going to gently massage that area just to calm the patient down, calm down that nervous system. We're going to move down into the fleshy part of the big toe and work the pituitary gland, gently massaging, pinching, releasing, doing circles on that area. If you come on down to the base of the big toe, you're going to work the neck and shoulders. And this will help, again, to continue that relaxation process. Thumb walking down the side, the medial side, the inside of the foot is the spinal column, and all the reflexes for the back, the spine. You would work these areas all the way down to the bottom of the foot. Massage that just to calm the person down, calm down their system. We're going to go to the pituitary gland, as I said, work that. You can work across the upper part of the big toe, which is the heart and lung, the chest cavity. The middle portion of the foot includes your stomach, your liver, depending on which foot, your spleen, and other internal organs. For the purpose of this routine, you want to come between the big toe and the second toe and find an indentation right at the base of the big toe and find that adrenal gland. The adrenal gland and the pituitary gland really influence mood, pain, stress, and you want to work that area to really calm it down. You're going to come over to this side in that same upper portion of the foot and work the solar plexus. The solar plexus is not an organ, but it is like a control center where a number of organs and nerve related to organs meet. And so by working this area, you can relax the patient. You're going to come down, you want to do a little twist on the foot just to continue that relaxation and pain reduction. If there are areas that are particularly painful and you're working on someone else, ask them if you can touch that area. Sometimes if you work on an area and it's tender, the first touch may be very tender, but if you can manage to apply a little pressure, gradually increasing for just a few seconds, you can relieve that pain in that area. So always, if you're working on someone else, ask them about their tolerance for what they're doing. You should always communicate with that person. If you're working on yourself, you know when you hit that nerve, and you know when to back off and when you can move forward. Come on down and rub the middle part of your foot just for relaxation. Often that is where a lot of tension collects. The people who have plantar fasciitis, this is where that builds up and hurts. So you just want to work on key points to help relieve pain and sensitivity and help that person relax. I'm going to switch positions and show you the routine on my own foot. So this is self-care. So you want to start by warming the foot up, massaging it, getting it ready for treatment. You start by massaging the top, doing circles, the top of the big toe, just to stimulate and calm that central nervous system. You can pinch a little bit, pinch and hook down, work in the center part, the fleshy part of the big toe. All of this stimulates the central nervous system. You're gonna walk down the side, thumb walk, all the way down the side. So much easier when you're doing it on somebody else, but this is about self-care. Rub areas where you feel sensitivity. Calm those emotions and that pain down. You're gonna reach to find the adrenal, and you wanna hold that. You're gonna come over to the other side and find the solar plex. Right in here, find the solar plex. If you're working on someone who has neuropathy, you can do both solar plexus. Apply your thumbs to the solar plexus simultaneously. You're going to go back and thumb walk down the spine. Keep going back to that because that generally calms the whole foot. You can work across this area for the heart and lungs, the chest cavity. Work across here for the diaphragm, helps to improve your breathing. Come down here and work these areas. If you have a little plantar fasciitis, you can work up and down this area. Come all the way down to the bottom of the foot and press in that dimpled area, right at the bottom of the heel. Work across the bottom of the heel to calm the sciatic nerve. People who have sciatica, this will work to calm your nerves and ease your pain. Give yourself an overall loving massage on that foot. And repeat this whenever the neuropathy flares up. you do it several times a day initially, you should begin to see some pretty significant improvement in the pain and the discomfort levels. So this is just a quick self-care routine, or one that you can share with someone you're caring for. Be gentle, loving, and help to calm down the pain impulses in those feet. Thank you for watching. If this has been helpful, please subscribe, like, and share with your friends. Black Girl Reflex, we're trying to make this a global movement. Self-care for Black and brown women. Thank you.